Good morning, everyone. We are very sorry we didn't start by 10 on the dot. We had some technical glitches, and thank God that hopefully this has been resolved. We're still in Nigeria, and we know that once in a while, the calls you could make from your house, then you couldn't make them again. Today, we're going to be talking about how we could take care of our heart so that it continues to beat for as long as we're alive, and not just beat very well and stay and in a very healthy condition. I still remain Mrs. Adetutu Afolabi. I'm a pharmacist by training. I'm an emotional wellness coach, and I'm the MD CEO of Wellness Healthcare Group. This monthly webinar has been brought to you by Wellness as usual, and we're grateful to God for His grace to keep us alive. We thank God for being a part of this. We want to say thank you to you for joining us. Without you, we couldn't even be having this webinar. Last month, we talked about erectile dysfunction, and I'll tell you that it got the most viewership than any other webinar that we've done. And it's surprising, some of those things that we do unconsciously, like riding a bicycle, could actually lead to erectile dysfunction. And the doctor had to tell men that ride bicycles the kind of bicycle the kind of seats of their bicycle, the kind of pants they should wear when they are riding their bicycles and all that. So information is powerful for as long as we try to chew it. So today we're coming to talk to you about the heart. So Wellness Health Group is passionate about improving the general well-being of the people, and that's why we do this consistently as well, because we know that information is power, and what you know sometimes might not be able to hurt you if you do not ignore it. So this medium is brought to you by Wellness. Wellness allows access to care, seamless access to care through our HMO platform, and we also make sure that people that come to our pharmacy enjoy quality pharmaceutical care. And with Wellness, there is no fake medications. All products in Wellness are quality drugs purchased from companies that we know that they cannot hurt people. So we do not do mago when it comes to the health of people and the life of people around us. So thank you for logging on. Please share the link with friends and family. Let's learn to hear from Dr. Jao today. Don't forget to also subscribe to our YouTube channel. I beg, I want you to subscribe to the YouTube channel. So I'm begging you, don't just watch today, subscribe to the YouTube channel. We need you to subscribe to it. So, and share the link after this. Please stay true with us. You never can know what knowledge that you need to pass to another person. So stay true to us. Don't bail out on us after 20 minutes. This promises to be exciting. And you're also going to be opportune to be able to ask questions. There's a chat button that you could ask your questions. Our team are available to make sure that those questions get to me. So feel free to ask your questions. We want you to be a part of this. Thank you very much. Today, Mr. Joshua is with me as well. Mr. Joshua reaches out to the special group of people that will only hear this through his gestures. Thank you, Mr. Joshua, for always being available. And today we have Dr. Jao. Dr. Jao is not just a doctor, he's also a pharmacologist. So the man sabi medicine well. Just sabi it's not like he just know the cardiologist thing. He knows the right medication. So Dr. Jao, Dr. Jao, we want to say welcome to this platform. Thank you for being a part of us. Dr. Jao, can you say hello to our audience?
Yeah, good morning, audience. It's a privilege having me around, and we hope everybody will be carried along appropriately and will all benefit from the discussion this morning. Thank you for having me around.
Thank you, Dr. Jao. So, Mr. Joshua, will you say welcome to our guys? Welcome our guys to the platform.
Good morning, everyone. My name is Joshua. I welcome everyone to today's wellness webinar.
Thank you very much. So that they know you can talk as well. Thank you very much, Mr. Joshua. Okay, so we go right on it. So, Dr. Jao, when people talk about the heart, most of us actually pay attention to hypertension. And that's the beginning of, when they say that somebody has an heart issue, they talked about hypertension. I know I'm going to ask you questions about some of those heart problems that we could pay attention to. So please, why do people have high blood pressure, or why what is hypertension? It's also referred to as a silent killer. Why is it a silent killer? I want you to just tell us that briefly before we go into the main questions.
Well, thank you for the question. Hypertension, traditionally defined as a blood pressure of 140 over 90 millimeters of mercury or more than that. When somebody has measured it at least 3 occasions, at least 1 week apart. So if it's consistently in that range, then the person is said to be having hypertension. Why is it a silent killer? Because many may have the blood pressure elevated and the person is not symptomatic. He's not having headache, he's not having chest pain, he's not having any form of symptom until it becomes a dramatic event causing emergency, in that a target organ now becomes involved and the person suffers the consequences. At the ER, emergency room, that's when you now know that the person has hypertension. So that's why it is called a silent killer.
So for people that have hypertension, so when you diagnose, when someone checks his BP, blood pressure, and it's high, you cannot conclude that that person has an hypertension. That's what you're saying. That this person has to check at least 3 times 1 week apart.
Yeah, it's not cast in a stone, because there are those who will just come for the first time. You see very high blood pressure and they're already having some organs affected. In such situation, we can term those individuals as having hypertensive crisis. It could be urgency, it could be emergency. So it depends on when the individual come and the blood pressure. It can even be lower than 140/90. And at that point, the person is already having organs affected. In fact, it brings to mind a definition by Rose, which was modified by Kaplan, that hypertension can be defined at any level of blood pressure when the benefit of an action, that is this time around treating the patient with antihypertensives, outweighs the inaction of not treating the person. So it's not cast in a stone, that 140/90, or the person coming 3 times and 1 week apart. So it depends on the individual.
Okay. So people should stop getting angry when a doctor just prescribes to them, because sometimes people complain that this is the first time and they're already being told to take medication. So what are the symptoms that people are ignoring? Because I don't want to believe that they don't have those symptoms. They could be. I remember my mom, when she was eventually diagnosed as being diabetic, she actually said she's been seeing those symptoms, but she felt it was old age. So she ignored them until I was like, what is happening? Because she was emaciating. I'm like, this emaciation is too sudden, and it's not even gradual. She said it was like, so what are the symptoms that people are supposed to pay attention to that they are ignoring because they are busy, or they are not just careful about what the body is telling them?
Well, yeah, to a very large extent, it is asymptomatic. That is, the person has no symptom at all. But in some individuals who are fortunate, they may start having some form of vague headaches. It's persistent. Their treating is not going. And so it could be a subtle sign that the person is having a high blood pressure. Then if the organs have been affected sometimes, maybe the vision, then it could be having some blurring of vision. And sometimes still the heart, the person may be having some form of undue fast heartbeats or undue awareness of heartbeats, or the person can be having chest pain as well. And sometimes if the heart is affected to a large extent, the person can be having issue with breathlessness with just a mild exertion. So it depends on the time the person comes. So sometimes it could even be some kidney issues. It's already having some kidney affectation and is having some reduction in the volume of urine and the rest. And so at that level, the person's target organ is already affected. So, but to a very large extent, just as I've said, it is asymptomatic. It is when maybe the target organ has been affected, most often that we now see the symptoms of those target organs that are affected.
This is serious. For people taking Panadol for every headache, sometimes if it is persistent and not going, is actually the time to seek the advice from a cardiologist. Wow. And it's so unfortunate when he said it could really be asymptomatic, and it's only people that are fortunate. That's a big one for me, because I actually thought sometimes many people just ignore. So sometimes it could just be asymptomatic, and by the time it's symptomatic, one might actually, the other organs could actually be affected. Wow, this is serious.
Really, yeah.
This is serious. So the advice on people to check their blood pressure regularly is very important.
Very important. Very important. And when you go for any other medical checkup, probably you just go for any febrile illness, walk into the hospital, don't just focus on the fever alone. Let your blood pressure be checked, especially if you are of adult age group. So let your blood pressure be checked. It could just be the only time the blood pressure will be detected to be high. Sometime right from even preschool level, the person is entering school, they do a medical checkup for the person, the blood pressure could be picked to be high. Sometime pre-employment, the blood pressure is checked. And these are people that have been moving around. They never knew they have hypertension until that point in time when the blood pressure was checked. So it is very appropriate walking into the hospital sometime if you have adult age, then get your blood pressure checked.
Can you tell me that adult age you are referring to? Because we have people in their 30s now having hypertension.
Fine. It's just the adult range. Hypertension actually has no band in terms of age group. Even the child or the children also have hypertension. And it's just that majority of those who now have hypertension in young age, you now are looking at probable other possible cause, apart from what we call the essential hypertension, which accounts for like 90 to 95% of those who have hypertension. But for younger age, if they now have, you are now looking for secondary cause. Could it be that the person has some form of kidney disease, such as glomerulonephritis, chronic pyelonephritis, polycystic kidney disease? Some could also even have some hormonal problems, such as Cushing's disease. They could have some issue with adrenal hormones, Conn syndrome, and the rest. So hypertension really has no age. But why I say adult age is that once somebody is getting to like 40, so many things changes in that individuals. So you could make sure you check your blood pressure. However, if you are going for pre-employment or in school and you check your blood pressure is peaked and it is labeled as hypertensive, I think it's something that should be addressed and attention should be given to it.
Thank you, Dr. Giles. So if people go to the hospital or they by chance walk into a pharmacy and their blood pressure is checked and is high, he's saying that you shouldn't just be silent on it. It's better we look at it and
Yes.
and make sure it's treated, especially because there are other end organs. There are some other organs that are related to the heart that could be affected at any moment. Thank you, Dr. Giles. So how does family history affect the heart health? How does family history affect the heart health?
Well, family history usually work alongside genetics, going alongside environmental issues and lifestyle choices. So they work together in synergy. So even though individuals have family history of heart disorders or cardiovascular disorders, such as hypertension, some individuals may have family history of it. Some heart muscle disorders, individuals may have family history of it. Obesity, cholesterol, and the rest. So family history may be there, but if the individual take note very early enough that in his family, for instance, he has hypertension, then he modify his lifestyle. Just as I said, he walks side by side with lifestyle, then environmental changes and the rest. So if he modify his lifestyle very early enough by reducing salt, take things rich in natural potassium and the rest, fruits and vegetables, then exercise as often as possible, that individual might not develop hypertension at all, or if at all is going to develop hypertension, it might not be that early as much as possible. So even though family history is there, lifestyle changes play a very good role or impact in developing such heart or cardiac disorders.
Thank you very much, Dr. Jao. So what you just said in simple terms is the fact that your parents have heart disease does not necessarily confer on you to have it as well. If once you are aware and you put in place some lifestyle modification, one might prevent it or even delay the progression of such disease. So people that believe that their parents had heart diseases and automatically it's fair if they have it, is saying that you could work against that tide, you could change that history, you could stop it at your own time, so that you don't just believe that because they have it, you could have it. And for those people working in fear that because your parents have had a kind of have had heart diseases, then you might have, is also saying that you could change everything just because you decide to modify your lifestyle. Thank you for that. That is very instructive, because I'm trying to work against myself having diabetes as well, because my mom had diabetes and I'm like, I shouldn't. So thank you, because I could actually work on my lifestyle modification and make sure that doesn't happen. Does it work with diabetes as well?
Well, although most of these things, they are not cast in a stone, really. One could still have done all his, that disorder creeps in. But at that point in time, your conscience will be clear. You know that you've done your own bit. Let it then come. Then you can then sit on it and manage it appropriately. So lifestyle is still very, very key. Although there are some disorders that, irrespective of lifestyle disorder, lifestyle changes, the person can still, because he has family tendency, he may still have it.
Well, I'll go and pray against those family tendencies. So I think prayer and lifestyle is the key now. You've told me another thing that will be the key: prayer and lifestyle. Then I'll do prayer. Okay, thank you. So I want you to explain some things to us. There are some words we mix together. So I'll give you an instance. Someone is on the phone and receives a shocking news, and the person just goes down. And they say it's cardiac arrest or heart attack. Then somebody sleeps and does not wake up, and we still say it's cardiac attack or heart failure. And so we'll do with, and then there's this other person. Okay, this other person that sleeps and they wake up already, they'll be managing him for hypertension. But there's this set of people, that they never had hypertension. They even checked their BP and it was normal, and that person sleeps and doesn't wake up. And it's not a matter of exhaustion, because I know some people just pack up because of exhaustion as well, and the person doesn't wake up, and they said it's still heart failure. Please, can you just help us? Which one is heart failure? Which one is cardiac arrest? Which one is heart attack? Which, and we just use it interchangeably like that.
It's true. So have a very good insight into the meaning of those terms. We first of all look at the heart being made up of both the electrical and mechanical components. The electrical component, that is, has the conduction and the current generation or impulse generation system. Then the mechanical component, that is the heart muscle, which helps in the contraction or pumping of blood. Then this work in synergy. It's just like the AC we have in our apartment. It has electrical current. Then you notice that something is driving inside the AC. You can't really see the electrical current and that is causing that, but you know that there is a current flowing to it, driving it. So same thing with this electrical activity of the heart, helping to make the heart contract or pump. But on top of the heart itself, there is a system of vessels, and predominantly the coronary arteries. These coronary arteries, they chiefly give the heart its own blood supply, apart from the little that is supplied by the heart, that by the blood that is inside the heart itself. So these coronary arteries might now have problem, either a progressive narrowing, then it then becomes blocked. Then that time it becomes blocked, it can now cause blood flow to the area lower than the point of blockage to be cut off. And the muscle around that area where that blood is cut off dies off. That is what we call heart attack or myocardial infarction. So it is similar to what happens in the brain in what we call infarctive stroke. When the individual suffers stroke, is similar to it. So what happened is that the person start having like chest pain and the rest, feeling of maybe impending doom, is feeling nauseated, feel like vomiting. So heart attack is in that aspect. It can be described that way. Then looking at heart failure, in fact, the final bus stop of all heart disease, the final bus stop of all heart disease is heart failure.
Final
just as yes, that's the statement I will use. It's just like kidney too, and all kidney issues, they end up with kidney failure. So same thing with the heart. The final bus stop of all heart disease is heart failure. And what explains this is either there is a problem with the pumping of the heart, or there's a problem with the relaxation of the heart, or a mixture of the two. When this happens, there is inadequate blood output, what we call cardiac output, for all the tissues to be used. Then the tissue suffers blood supply for its necessary metabolic needs. Suffice to say that the heart attack that we mentioned, myocardial infarction, on its own, it can cause heart failure. Then, as regards cardiac arrest, what happened is that, just as the term puts it, the heart is arrested. It's just like a law enforcement agent arresting one for no reason. You become stunned, you become dumb. So the heart just stopped beating.
Wow.
And it's usually as a result of chaotic, violent electrical activity, like what we call ventricular fibrillation, ventricular tachycardia. So they cause this, and the person the heart stops immediately. If nothing is done by means of what we call CPR, cardiopulmonary resuscitation, the person dies outrightly. So the words may be used interchangeably, but they have different meanings. Although there are other causes of cardiac arrest, apart from electrical activity, such as maybe you have too high electrolytes, such as potassium, or too low, or there is high fluid surrounding the sac of the heart can stop, or in individuals who have pulmonary embolism, have a clot that is quite large enough that is thrown into the pulmonary artery. So the person too can have cardiac arrest. So, but the predominant cause of cardiac arrest is that chaotic, violent electrical activity, which can be as a result of a sequelae of the myocardial infarction, or even from heart failure itself.
So for all of these three, for cardiac arrest, heart attack, and heart failure, that means that person must have had some heart ill health for it to happen.
Very, very good. Yes, that person most often have had an abnormality in his heart. Although there are those who probably will not know at all, but it is ongoing. And like footballers, they can just be on the pitch, especially for cardiac arrest. They have some heart muscle disease that wasn't diagnosed, and what we call cardiomyopathy, especially the hypertrophic cardiomyopathy. Then because that condition has tendency of causing violent electrical activity, by the time it's now exercising, that can come up and the person can die suddenly from it. So there are some also that have some conditions that may not even be known at all, what we call channelopathies, and the person can just die from it. because of violent electrical activity. There are those who do not have any heart issue at all. They are playing a rough play or baseball, for instance, then the ball strikes the chest wall where the heart is located. That's what we call commercial cordage. So it acts on that electrical activity as well. The person can just die suddenly as well. So there are so many instances whereby the person overtly has no known cardiac issues, yet can just die suddenly. But still, like those who have heart failures, one of the problems that occurs in heart failure is that the cause of death in heart failure is just this electrical activity as well. They might just sleep and they will not wake up because while in their sleep, they develop that chaotic electrical activity and they just die and will not wake up from it.
So, Dr. Jao, so apart from checking blood pressure, what are the other things people should check? Because, you know, sometimes it's scary. You hear news, people in their 40s went to sleep, they didn't wake up. This person is not a known hypertensive or known heart, just like you said, sometimes these conditions are there and people do not know. And even though the person is checking his BP, blood pressure, it's not showing on that. What are the other things? What are the other tests that, aside blood pressure, that people should occasionally, once in a year, try to check so that you know, so that this does not happen, especially when someone is a breadwinner, a mom, even we've had people in their 30s, you know, just say they have headache and they want to go and sleep. You know, sometimes people have headache and you just want to eat and sleep and the person doesn't wake up. What else should people look out for? You are a cardiologist. Just educate us. What else should people look out for? The reason why we're having this is not because we want to scare people, but because every one of us hear this news and it's always scary when we hear them. And how could we, you know, protect ourselves and, you know, keep ourselves alive? So what are the other tests that people should occasionally look out for aside blood pressure? You already told us that some of these symptoms you might not even see it, you might not have it. It's not as if you're ignoring yourself, but you're not feeling anything. So what are the other tests that people should occasionally just do to be sure that their heart condition it's healthy?
Well, some of the key things that people could check reflects the other cardiovascular risk factor that could cause these conditions, such as checking the cholesterol level, because high cholesterol can cause a heart problem in the long run. Then also blood sugar is very, very, very key. Somebody needs to be checking his blood sugar as required. Then the other thing the individual could check is making sure he checks his weight from time to time. Because if you look at the parameter we use in looking at some of these cardiovascular metabolic syndrome, for instance, we look at waist circumference. But it doesn't mean that we can control, at least to a large extent, our weight, but we cannot control the height, because BMI has to do with the relationship between weight and height. So weight, we need to check it. Then if we see that we are off the target, then we should exert ourselves the more, make sure we do enough physical activity as much as possible, then eat healthy. Then those things will help us as much as possible.
Okay, I want to ask you a question. You know, when it comes to BMI, I've had to argue that with a lot of people, and I sometimes keep quiet about it because everybody keeps saying that BMI is not applicable to Africans. It's not easy for Africans not to be obese. It's not easy for us to have a normal BMI, healthy BMI. Is it true it's not applicable to Africans? I'm laughing because, oh God. Is it true? And please, maybe you should explain in simple terms. I try to explain to people so that it means that the height God has given you, you are carrying too much weight for your height. And that is why
Exactly.
your BMI is high. And that means you are overflogging the organs in your body are going to be overworking to sustain you when you have a very unhealthy BMI. But people keep arguing that no, this BMI is not for Africans. Please, can you just help us so that these risk factors we can work on?
I wonder why some will argue it's not for African, because we Africans, I think we are even more physical than the Caucasians, and we trek more than them, and we do some physical things more than them, except for the fact that those of us in urban areas where we drive all the time, we have a driver carrying us. You are driving your car. In fact, you want to drive to that point you want to enter. You want to enter a pharmaceutical store, for instance. You want to drive to that entrance of the pharmaceutical store. So apart from that, BMI can actually be controlled also in Africans. And what is the control we need? The normal range is between 18.5 to 24.9. And so anything less than that is a problem to the heart. Anything higher than that is a problem to the heart. So if it is high, it's a risk for so many cardiovascular disorders, metabolic syndromes, and then hypertension, diabetes, insulin resistance, stroke, heart attack, and the rest. Then if it is low as well, in fact, the heart can become weak because the muscle can reduce. Then the next thing is that the heart pumping also can reduce. Then the next thing is that electrical activity now becomes dysfunctional, and the person can have some form of arrhythmia or abnormal heart beating that can affect the heart in the long run. So BMI, looking at what we eat, even as Africans, and vis-a-vis making sure that we are physically stable in terms of applying ourselves to exercising, then it helps a lot. So it is not beyond us Africans.
Okay, so the BMI parameter is within our reach. Dr. Jao is saying that for every one of us, we should try to have a healthy BMI. It's between 18.5 to 24.5. It's actually calculated
24.9.
24.9 is actually calculated by multiplying your weight over
weight
height
divided
squared.
by height squared. Yes.
Yes, that means your weight divided by your height by height. So since we do not have any, we can't tweak our height. I can't grow taller, and I cannot grow shorter. Then I should work on my weight. And most of the things that makes us grow bigger every day is actually comes from what we eat. Sometimes we make fun of ourselves that even if air blows on my body, I'll grow fatter. So for those of us in that league, he's saying that we have control. Those are risk factors to heart diseases that people have to prevent. With more weight, you already have high cholesterol. So he's saying that you shouldn't just check your BP, you should also check your blood sugar. Blood sugar and BP goes hand in hand. And if you believe your BMI is high, just check your waist circumference. When you check your waist circumference and it's not, I think for men is about what's the
less than 88 for men. I mean less than 102 for men, then less than 88 for women.
Less than 88 for women. So
then for men, less than 102.
102. So just check your weight. Just tell your tailor to just help you check your weight. If it's more than 88 for women, then you are at risk. And if it's more than 102 for men, sometimes also women believe that because we've given back to our babies, that's when the expansion, started. And of the truth, the expansion actually started when you start having babies and all that. But the babies will go to their own families and all that. Don't let us continue to put ourselves at risk. And for men, the doctor is saying that IQ now must be below 102 for that money to be with you for a long time. So while you are thinking of having the tummy so that you can be respected, please, he's saying that there are other useful, that tummy circumference, that waist circumference is very important, and it could be a predisposition to other things. Thank you, Dr. Jao. Thank you for breaking it down. I also want to ask you a question. So women become hypertensive as a result of pregnancy, and they just become hypertensive. You know, during pregnancy, they realize that they are hypertensive, and after pregnancy, they're still hypertensive. And I've lost a friend that was pregnant, then let's add hypertension. In another 10 years, there was kidney failure and all that, and it was a very sad one. Was a very sad one. So how can women prevent hypertension in pregnancy? How can they prevent hypertension in pregnancy?
Well, hypertension in pregnancy usually starts from pregnancy age of 20 weeks and above. And it can even happen for the first time after delivery and can last up to 12 weeks after pregnancy. So there are some very key people, female who are pregnant or about to be pregnant, who are at risk of developing this pregnancy-induced hypertension, or what we call gestational hypertension. People who have had it before, they are at risk of having it again. Then if the person is 35 years and above, is at risk of having it, or is having multiple gestation, like twin pregnancy, triplet, is at higher risk than the person that is just having one baby inside his womb. Or the person ab initio has hypertension before, he can develop on top of it pregnancy-induced hypertension, or diabetes, or is obese. So that is why, just like any other person that is not pregnant, the same lifestyle is applicable to such women. That is, cutting down the salt you take. When I mean cutting down the salt you take, like what I usually tell my patient is that until somebody in the family that participates in the same meal with that person starts complaining that, oh, mommy, it's like there's no salt in this food. Or my wife, is it that you didn't put salt in this food? That's when the individual knows that the salt content has been reduced. But what actually is prescribed by the regulatory body is less than 2 grams of salt per day. What is less than 2 grams of salt per day? If you take a teaspoonful of salt and level it, that's like 233 grams. So what you just do is to, 2.3 grams, sorry for that, 2.3 grams. Okay. What you just do is to reduce a little from that level tablespoon. That's less than 2 grams per day. There are those that may even have stricter prescription, or less than 1.5 grams. So if you take that level teaspoon, then probably make it half of it. That's the total amount you take. But just as I said, what I tell my patient is, until somebody starts complaining that there's no salt in the food, then eat things rich in natural potassium, citrus fruit, banana, fresh tomatoes, pear, nuts, and then take things like cucumber, cabbage. All these things, they are very, very important. Then avoid eating late into the night. Eat your last meal as early as possible, 5, 6, maximum like 7. Then if you want to take something thereafter, maybe fruits and vegetables, then make sure you do exercise regularly. Exercise that is prescribed is like 150 minutes in a week. And what that means is that if like 30 minutes and 5 times a week, you can spread it out. It doesn't mean you must see that target right from the onset, but start from somewhere. Then the drug that has been tested in this group of people that is useful in preventing gestational hypertension is aspirin, simple aspirin, 75 milligram or even lower than that, it's 1 milligram, or even lower than that, just as I've said. It's very, very useful. It's been seen to reduce the occurrence of this event and even prevent death around delivery period. Some have gone to the extent of using calcium, then some vitamins such as vitamin E, vitamin C. These have been found not to be useful. You know, we do evidence-based practice. So if research shows that it's not useful, then you throw it aside. So there's no point using calcium and other vitamin supplements. But the only thing that has been found to be useful is just simple aspirin.
And prevent gestational hypertension. Thank you, Dr. Jao. This is very enlightening. So we're still going back to the fact that a lot of things can be prevented with fruits and vegetables. Food rich in potassium, eat lots of nuts, cucumber, cabbage, citrus fruits, and all that. Can you help us with bad cholesterol and good cholesterol? I know that there's some researches that shows that people shouldn't even be taking this statins drugs because the cholesterols are very important for the body. And now you said high cholesterol is a problem. Which are good cholesterol? Which are bad cholesterol?
Well, cholesterol on its own is not bad because it's useful in producing some certain steroid or cholesterol-based hormones in the body. Then even vitamin D, some digestive juices, it's useful in those aspects. But the concept of good and bad cholesterol emanates from the fact that there are some components of this cholesterol that could aid atherosclerosis, what we call atherogenesis, that is causing thickening of the inner lining of the blood vessel. And low density lipoprotein is the one that is incriminated, and that is why it is labeled as the bad cholesterol. Then while high density lipoprotein does the opposite, it helps to mop up the bad cholesterol, take it back to the liver for it to be excreted via the bile and the intestine. So what is the normal level that we usually ask for, we advocate for? For the bad one, LDL, we usually say, oh, it should be less than 100 milligrams per day. Although there are some population where, in fact, the current guideline and European Society of Cardiology is saying that we should even aim at less than that 100. This time around, not even less than 70, less than 55. Those who already have high risk for cardiovascular disorder. You have that 10% you project that the risk of developing cardiovascular disease in the next 10 years is 10% and above. So you have to hit a target of less than 55 milligrams per day. Some even advocate, they even push for 40 milligrams per day. You know? So to tell you the extent of why this bad cholesterol should be as much as possible reduced. You will see some person, they will come to you, doctor, my cholesterol is already low now. Why are you still continuing the drug? Then the explanation has to go on why you have to continue. Then the good one, HDL, what is recommended by the National Institute of Cholesterol Program, ATP3, is that for men, it should be more than 40 milligrams per day. Why for women, it should be more than 50 milligrams per day. So then for triglyceride, it should be less than 150 milligrams per day. Then the total should be less than 200 milligrams per day. So these things are contained in some fats, what we call the trans fats, the saturated fat, then the unsaturated fat. The trans fat is the worst one because this is a type of fat that has undergone serious heating at a very high temperature, just as very high frying and the rest. So reason is because it has high bad cholesterol, that's the low density lipoprotein, and has a very low HDL, the good cholesterol. Then the other one, the saturated one, it has the good one to be high and the bad one also to be high. That is, the LDL is high, the HDL is high. Then the unsaturated one, it's the best really because it has a low bad cholesterol LDL. Then some say it has a low I mean, a high HDL, but actually some researches have shown that it's not really pushing the HDL high, but rather it helps to reduce the total cholesterol to HDL ratio. So, but by and large, it also increases the HDL level. And there are certain foods that contain these different type of fats, that is the trans fat, the unsaturated fat, and the saturated fats.
So can you give us foods that has unsaturated fats? That's the one that we should concentrate on.
Yes, exactly. So things, fruits, food like fish, like salmon, mackerel, and they have that oil. Then nuts too, and nuts like almond, cashew, even walnut, our traditional walnut, it has that. Then you're talking about avocado pear, it's also good in that. Then even our goat meat to some extent has it has unsaturated fat. Then some vegetable oils, and especially if the source as in and the constituent is actually screened to be having as labeled by the manufacturer to be having unsaturated fat. So they are like that.
Okay, so for us women that cook, and for men that eat, and every one of us that loves to eat, fry. Some of us like fried plantain. I love fried plantain. I can eat like 4 times in a week. I need to be cautious of the kind of veg oil that I'm using that is unsaturated fat, has unsaturated fat. So I think what is as done for us is for us to watch out for the kind of oil or the kind of fat in the meals that we eat. If it's unsaturated fat, then it's healthy for us to consume. If it's not unsaturated fat, then we might actually be increasing our risk of exposing ourselves to cardiovascular diseases by eating stuffs that gives us cholesterol that are bad in our system. For everybody listening, please check out the kind of fats that you use, the kind of oil that you use, and make sure that it is unsaturated, so that you're not enjoying life and at the same time also causing harm to yourself. Thank you, doctor. Thank you, Dr. Jao. Okay, so a lot of people have problems. They have problems with the fact that when they have heart diseases, they are compelled to use their medication forever. You see a lot of people saying that, oh, Ma, you're not refilling your medication. And she's saying, no, God has healed me. I'm not taking it again. And sometimes I asked, have you gone to the doctors to check? They said, no, I believe. I know that faith works. I know God heals. What advice will you give people? I know it's not also easy to take medication every day. I'm a pharmacist. We recommend medication. And even when I have to take medication for 7 days as an antibiotic, even to, maybe give my children, I know it takes a lot of mental consciousness to get that done, as in you're making sure it's twice a day, you're giving it in the morning and in the night, and you're not missing any day. And if I have to go on medication as well, it takes a lot from me. And these are people that they start and it's like there's no turning back. What advice will you give to them? What admonition will you give to them?
In fact, thank you for that question, because this is actually one big challenge, because starting medicine in patients, especially blood pressure drugs, there is this big inertia starting it, or inertia changing the dose. It could come from the doctor, really, and it could come from the patient, just as you said, that, oh, if I start this drug now, forever, I will be on the drug. So the advice is, just as the Yoruba people put it, tí o bá nídìí, obìnrin ò ń jẹ́ kúmólú. So there must be a reason why you are taking this drug. These are drugs that have passed through level of evidence and class of recommendations in clinical trials, in which the benefit of taking those drugs far outweigh the risk of not taking them. So it's to encourage such person, encourage the person that you need to be on this drug. But The issue about compliance with the drug is a big challenge. And once the reason why the person may not be able to comply is known, then we can address it. For instance, it could be the cost. The person might be giving you reasons, but just because he has no enough funds to be able to sustain the use of that drug, then he will say, I can't be using this drug. In such persons, of course, there are generic products. We can encourage the person that we have cheaper yet effective ones that are still very okay for the patient. Then it could be the side effect profile that is discourage the person from making sure he takes his drug. Then as regards the side effect profile, for instance, maybe he takes the food on empty stomach and he starts having some discomfort. Then we can tell him, okay, take the drug while eating, except a particular drug that you must take on empty stomach. Then it could be that you take the drug and you are not able to sleep just because you took it close to your bedtime. As some traditionally would take statin in the night, that my doctor say statin must be in the night. Not really, it's not all statin that should be taken at night. So if I notice that my patient takes statin at night and is not sleeping well, if there is no contraindication, I can change to the one that you can take daytime. The ones that specifically must be taken at night are simvastatin, fluvastatin, and lovastatin. So reason is because they have short duration of action. And statin works mainly when the synthesis of cholesterol is high and it is in the night. But for the ones that have a longer duration of action, like rosuvastatin, atorvastatin, pravastatin, really you can take them any time of the day. So I use that to address the side effect profile. Then the other thing that could make the person not complying with the drug is multiple drugs. The person is having hypertension, is having diabetes, cholesterol is high, maybe the heart has failed. So in fact, the person can even be on like 10, 15 type of drugs.
Wow, so that's a lot.
How do we address this? We address this, fortunately, some of the pharmaceutical companies, they've been able to do what we call fixed pill. That is, you have just one tablet and it's having about 3 or more agents. So it's like fuse everything together to reduce the quantum of the number of medications the person takes. So it sort of reduces that and the person can comply better. Then sometimes what I tell my patient is, oh, if you have issue with complying, just keep this drug for night. Know that in your prayers, there is something you should always also do before you go to bed. That is, oh, my drug. Let it always ring in your mind that, oh, I need to take my drug for sleeping. Then the other problem about compliance is issue with insufficient time educating the patients on the disorder and the rest and need to take the drug and the rest. Reason is because you look at the patient you have outside on queue, waiting to enter the consultation room as well. It's so long and there is no enough time to give one particular patient. This is a patient that has left his home with all sorts of problems that, oh, if I come to my doctor, I'm going to get my problem solved. But you virtually unable to address everything because of a shortage of time. At the same time, in a bid to even try to address issue for maybe 1 or 2 or more of these patients, those on the outside will be agitating. But let me tell you, by the time that person goes out and that person that was agitating comes into your consultation room, he too will not want to go out. He will stay with you, pouring out all his problems. So there is really a problem with this time issue, and it's universal. So it's just because we probably more hands will be needed to at least reduce the bulk of work on one specialist or the other.
Thank you, Dr. Jao. I know how you feel. I've worked in general hospital before, and as a young pharmacist, you want to go through the explanation and everything. And while you're trying to make this person feel good, you have to take this medication, you will see the other guy shouting, give him what you want to give him and let it go. And you're just like, as a young pharmacist, I just want to do it well. And my boss would be like, added to the people, there is no time for all this, your lecture. I was just practicing what we're taught in school. How are you, madam? So how are you feeling today? There's no time for that. Stop all that. And it's not just that patient, even other patients are some of those people that mount pressure on you, and that could be difficult. But for everybody that has fresh diagnosis, we should try to engage medical personnel, ask more questions, and all that. I think the thing is, we should learn to ask more questions as individuals. You might not be able to ask that doctor because Dr. Jao also practices in Lutz. You might not be able to ask that same doctor all the questions, but if you could ask other health personnel and ask questions around what's the diagnosis and everything, but make sure you're asking the right people. Make sure you're asking the right people so that you're not asking people that will compound your problem or people that will just say ignore. I've had people say that they just showed someone, that person said ignore. I said, that person you showed, what's the qualification of that person and the person that gave you the medication? Just seeking the information that is needed. So for people taking medication, it's also begging us to please comply. These medications have gone through some tests, they've gone through some research, and they've been saying that they could help. We need to take our medication if we've been diagnosed of any heart, cardiac ill health. I want to say thank you to Dr. Jao. Dr. Jao, what else? Do you have anything you want to tell her? Just we're rounding up now. Do you have anything you want to tell our audience?
Well, just to appreciate the audience once more for giving me that privilege of being able to address them in this manner. And World Heart Day was September 29th. It tells us the essence of how passionate we should hold our hearts. And as we hold our heart as well, we should also see how we can help others as well in terms of their hearts. So let's take our heart health seriously as much as possible because sometimes some of these conditions, they don't ring bell. There are no alarm signs or symptoms. They just come, and by the time the signs comes up, it's at the emergency room and it might be too late. But we don't pray for that. That is why we say lifestyle modification is very key. We should do that. And at the same time, especially those who have family history or risk factors for some cardiovascular disorder, they should make sure they see their general physician, and then who would then probably refer to the cardiologist for better evaluation. Thank you for listening once more.
Thank you, sir. Thank you for everyone. Thank you, everyone that has logged into this. Thank you for logging on to this webinar today. We appreciate you from Wellness. I want you to subscribe to our YouTube channel. I want you to watch all over again. I would love you to send the link to friends and family to also listen. And also, please don't forget, he told us that he told us some risk factors that could predispose us to cardiac disease. And one of it is for us to not just check our blood pressure regularly, also to check our blood sugar. It talked about a weight, that we might not be able to control our height, but we have our overweight. And we should ignore that. We should ignore the fact that BMI is not for Africans. BMI is for Africans as well. Let's keep a healthy weight. Let's eat healthy. Let's do exercise regularly. At least 150 minutes of exercise daily, weekly is good enough for the heart. That is, you could spread it 5 times a day, 5 times a week. 5 times a week in minimum of 30 minutes. He advised that we should eat meals that are made with unsaturated fats. Those are the good cholesterol into our bodies. And he talked about fish, he talked about salmon, just goat meat has some of it. And of course, nuts, walnuts. Some of us don't like walnuts, but because it's bitter, he said it's good for our heart. We could engage citrus fruits and all that. For people above 35, we need to make sure that we have a healthy lifestyle. Healthy lifestyle can help us. So checking blood pressure is not enough. Let's do more than checking blood pressure. And the fact that you might not know if you're hypertensive is one of the reasons, because it might be asymptomatic. It's not about you ignoring the symptoms, it's the fact that the symptoms are not coming. So check blood pressure regularly. Most pharmacies have a blood pressure machine that you could check. Hospitals also, when you go to any hospital, even before they do anything, they check your blood pressure too. Please don't let them just check your blood pressure. Ask for the value. Ask them what is the value. Let them ask for the value so that you know the value, and you know that if it is below 140/90, you are okay. Dr. Jao, 140/90 or less?
Well,
120/80. People say 120/80. And the best is 120/80.
Yeah, we call it optimal blood pressure. Less than 120/80, optimal.
Okay.
That is the best. But just like what I said, that it is not cast in a stone. Person can have a blood pressure that low, yet have problem. And in fact, there are those who even will have a blood pressure of about 115/75. Yet they come up with stroke, they come up with cardiac arrest, they come up with myocardial infarction. So it's not really cast in a stone. That's why the person must see a doctor.
Okay, so he has said it again. So when you go to the hospital and you're diagnosed, please ask more questions. Don't just take the drugs and go home. And if the drugs is given, it says reasons why people don't comply. If it's expensive, you can ask for alternate options. If you don't like the side effects, you can come back to see the doctor and they look at it. Some of them causes, I know some people take Moduretics and they take it in the night and it doesn't allow them to sleep. We're telling them take it in the morning so that you can go to the toilet and urinate and all that. So you should see your doctor instead of just jumping the medication. See your doctor about the side effect. See your doctor about how you feel about the medication. See your doctor if the drug that you were given isn't giving you relief, so that they can look at it and change it, because they are there to check other things and make sure that you get the right medication. So somebody said I should ask the question, I'm sorry, that does heartbreak cause heart failure? You're muted, Dr. Jao. You're muted.
All right. I say that's a big question. Heartbreak causing heart failure.
Yeah, well, does heartbreak cause heart failure?
Yes, I will explain that. That's why I say it's a big question. Big in that there is a form of heart failure. We call it Takotsubo. Takotsubo cardiomyopathy. So in that sense, maybe it can cause heart failure. And so it's as a result of all those intense emotional issues,
the release of
adrenalines,
and the electrolytes and the electric, everything just start misfiring.
You got it.
Okay, also heartbreak can cause heart failure depending on how healthy the heart is, because actually the person that has that heartbreak might not even know that it has some underlying symptoms of a cardiac disease. And so with the heartbreak and the misfiring of electrolytes, a lot of adrenaline pumping, that person could have heartbreak, heart failure. Thank you very much. So on this note, we want to say thank you to you again. Thank you for always coming on this timeline to watch. We want you to send the link to friends and family. Please subscribe to our YouTube channel. Follow us on our social media platforms, wellness_care. We want to be a part of your lives, because we believe that this information that we get from here, for me, it makes me more knowledgeable every time. For the last 9 months, I've been better than who I was, even clinically, as I relate with experts, as I relate with specialists in different fields. The knowledge I've gained in the last 9 months has been wow. So I enjoy doing this because it's an opportunity for me to learn. So thank you very much. Thank you for being a part of this. We love you. And until next month, we want to say thank you for being a part of this. Until then, thank you very much. Thank you, Dr. Jao. Thank you, Mr. Joshua. Well, that's it all.